Hi, I'm your chairman today, Crystal. Today for discussion 9, each group member will discuss an experience they had at the clinical site. This can encompass anything from situations with patients, their family members, or even staff members. It's okay to discuss difficult situations with staff members. And then he just says, however, comments in the discussion should not be disparaging or slanderous in nature. Um, so like a I guess I'll start. So a difficult situation I want to say that I've been in is probably just in trauma situations. I sometimes like kind of don't know what to do at times or like how to set it up or go about it. So I've had a lady come in and she broke her like humeral head when we took the x-ray, and it was really hard to like position her, and like for the AP was easier, but with like they always want you to do like the teacup. I found it easier just to do this and just to put it right over them, and we were able to get the image that way by angling the tube with the portable. So I felt like that was really like a learning experience. So next time I feel like I get a humorous, I can kind of attempt to try to do it. So it's just hard because their patient's always in pain.
Right. You're getting some really good experience though. I mean, that's amazing.
Yeah, traumas are always kind of scary going into them, like nerve-wracking. Like
Mm.
yesterday, I had a trauma too, and so we're just waiting, and we're always like the last ones to go in. And I'm always nervous, but the tech's like, okay, we're gonna go in when they say X-ray, and we're gonna because they're always trauma gurneys. Like, okay, just like adjust the plate under for the chest, and then he's like, but I'll double check it to make sure like you're okay. And he's like, but I'll bring the base of the portable in because right now we're using a portable for the trauma room since they're redoing ours. And so then he's like, okay, they said X-ray, like go in first. And like, but all the doctors were still there and like they're still like stapling and stuff. Like they said X-ray and I went in, but they were just surrounding him. And then I look at the tech, he's like, no, like go in. But I was like, no, there's like no way. Like I'm gonna tell these doctors to move as they're like cleaning and like doing this. And so it's just, I feel like it's miscommunication because sometimes the techs think like I am okay to go, but like had I like moved the doctors out of the way there and be like, who is this? And he's like, oh yeah, like I guess it's situational. And I was like, yeah, I don't want to tell the doctors to leave.
And then, yeah, sometimes you just have that 1 second to go in and then just take the picture, and then they'll look at it real quick and then start working. Like
Yeah.
it's like such a quick process, like to even know what to do.
Yeah, and like you said, I mean, if the patient is in pain, sometimes you don't know how much or how far to move them or how to move them, like where to grab them. I know techs usually like to go under the sheets, but for example, if they have their arm like this and you need the humerus a little abducted, you have to move it a bit. So
Yeah.
that's
Yeah.
the sensible part of the traumas.
Are you going in by yourself or is the other technologist, like the supervising technologist, like standing outside the room while you go into the room yourself?
They're with me, but like they've been like putting me first to just like position it and then do it myself. And then if I need help, they'll
That's great.
come. So they've
That's
been
really
like
great.
letting me do that. So it's like I have to like really think like, oh, what should I do? Like so it takes
That's
a
valuable
minute.
just throwing you out there and then you have to like be in that uncomfortable situation and like you have to figure out what to do. That's
Yeah.
that's great. Wish I had that.
And then I guess I'll just go in order. Angela, do you want to go next and share an
Yeah.
experience?
Yeah, so whenever we're in the department, we have a lot of procedures for fluoroscopy. So it's either like swallow tests, lumbar punctures, like upper GIs. And I feel like a lot of them are just smooth, like swallow tests. The patients are just eating and drinking like contrast. And that's like pretty easy. And then like the upper GIs are like drinking contrast and like the doctor's kind of doing everything, like moving them around. And then for the lumbar punctures, we're there just taking the pictures whenever they ask. But for the lumbar punctures, for me, it's always like I get so nervous for the patients because they are they're trying to get CSF, like spinal fluid from their
Yeah.
neck. So they had to like go through a small frame, what is it? Through the spine, like a little hole, and they're like poking a needle in them. And sometimes, or a lot of the times, it's like the residents doing it, so they're still kind of learning. And sometimes I feel like the patients are in pain or like wiggling or moving, and I get so scared for them every time I do a lumbar puncture. And there was one patient too that, like, she said she felt like a weird sensation going down her like leg. And just every time I go to the lumbar punctures, I get so scared because like I know it can't be comfortable getting like a
Mhm.
needle in your back. And then like for them to get a bunch of spinal fluid out, and then after they're like, oh, you might have a headache, like drink water to like the patients. But I think those are the hardest for me because I feel like the patients are always uncomfortable. So then I kind of just am standing there just feeling bad
Right.
for
You must
them.
want to make a face too and like to have a show.
Just like waiting because sometimes it takes them so long to get to the through
Mhm.
to the spinal cord or whatever, wherever it is. Sometimes it takes a while.
And what do the techs who've been there do as far as like trying to, I don't know, make the patient feel better, or, they're like, it's only going to be a little bit longer, or
Yeah,
what?
like almost done. Like, don't move, try not to move. It's okay. And then like, I mean, the radiologist will like give them more lidocaine
Mhm.
to help. But I feel like still a lot of the times they still like kind of like feel it. And like that can't be comfortable. And
Yeah,
especially for
yeah,
sometimes
we have a new guy too. Like, and he takes like an hour usually. You
for
took an hour.
lumbar punctures.
Yeah. And that was wetting towels, like to like give to the patient because she was getting like so hot just from being there for so
Yeah,
long. Like I felt so bad.
it can't, yeah, it cannot be comfortable doing that probably for the patients. But I like never know what else I can do because yeah, we just are there to take the images.
Yeah. Does anyone have any comments? No? Okay. So we'll go to Adolfo.
All right, so on a salofluoroscopic procedure, Amanda was accompanied by his daughter and his wife. I was having trouble swallowing, but also he was losing the ability to speak. There were a lot of people in the fluoroscopic room, so we had to ask for either the daughter or the wife to wait outside. I accompanied the wife back to the waiting room, but as soon as we stepped out, she started crying because she was feeling useless in helping her husband. I comfort her, and then I went back to the fluoroscopic room. But that moment touched me, and it stuck with me the rest of the day. Seeing how it's not just the patients, but their family members that count on us to alleviate their situations really put a little bit of weight on me. And it wasn't anything like too serious, but just seeing how much she was crying, how bad she was feeling because she couldn't really communicate or help her husband. And I mean, you also have to support them, not only the patient.
Yeah, it's hard in those situations because I'm still sometimes I don't know what to say to family members or even patients after like the lumbar puncture. Like I don't know how to comfort them sometimes. I don't know the like, right words to say.
Yeah, even when we're doing the first portion of like introducing ourselves and ask them if they have any history of cancer, when they say yes, it's hard to say, "Oh, I'm sorry," you know? You just have to like be okay and write it down. But yeah, it's just hard getting used to that.
Or if they're looking like they're doing well, I said, well, look at you. You're right here. That's amazing. You know, or else acknowledge it and be like, I'm sorry, but look at you right now. You're here and you look great.
Mhm.
Give them a positive. But I've gotten in trouble for talking too much. If I'm not confident, I'm too confident. What is it?
But that's like a good way to like comfort, you know, with some people. I feel like it would work.
And I was gonna say, Kendra, I need to take some like advice from you on what to say to family members because you would be a good person to like comfort.
Really?
Uh-huh.
Oh, that's very sweet of you. Thanks, Angela.
Mhm.
Just say you're sorry, that's
Yeah.
all. And just, give them eye contact and give them a little time, like it's so corny to say, but hold space for them.
Yeah. Does
Sometimes
anyone
I'll do, like a pat on the
comment?
shoulder, that sort of thing.
Oh yeah. Does anyone have any more comments for Adolfo? Okay, so we'll move on to Kimberly.
Recently, I haven't really had like much like experience challenging because it's been kind of slow, honestly, the past couple weeks. But I have noticed like the way different techs, not like the way that they handle patients, but the way that they interact with each other in front of patients. I noticed that's definitely something I don't want to be getting in the habit of, because I noticed they're not always the most like professional, and like they'll be having their personal conversations in front of the patient, and I realize like the patient, just because they're asleep doesn't mean they can't hear, just because they don't speak English they don't hear and stuff like that. So it's definitely like I took that into consideration when I'm like in the future being a tech. I definitely know like to be professional, because like the things that they be talking about, it's not something to be talking about at work, let alone in front of a patient. So it's definitely like learning what to do and what not to do. So I get a lot of that at my site right now.
I think that's great, Kimberly. I mean, it's good to learn from what you see in front of you. And
Mhm.
yeah, it's true. I mean, what we learned in like CNA, the patient can definitely, if you think that they're not conscious, there's a lot that they can hear.
Mhm. And
Oh.
I had noticed a lot of them don't have much sympathy, and some of them actually question like the images they're taking. Like I noticed, I didn't hear like personally, but I heard another one of our students in the program. They heard a tech make some snarky comments about a patient getting images when they weren't gonna make it, and I'm like, that's not the type of comments to make, you know. That's kind of not very professional, and to be saying that at work in front of who knows how many patients could have heard, you know. I definitely
Yeah,
knew that's not one to be.
yeah, that's like not a good thing too.
Right.
Yeah, because at mine sometimes they'll leave the door open and like they're getting an IV or something. Sometimes they'll use our room. So I'm just like they should at least like close the door or like be in there with them so that they're not open to like everybody in the X-ray department.
They don't get much privacy.
Yeah.
I agree. I'm definitely learning how, what kind of tech I want to be by looking at the ones practicing around me.
Yeah, also, I've been with a couple of techs that when we are in the room and they position the patient and they will make comments saying, for example, that's a big man, so you should go up in the mass, something like that, you know. But even comments like that can make someone feel uncomfortable. So maybe either whisper it or just them moving up the mass and then tell you the comment afterwards, or using more medical terms, just saying up your mass for a bariatric patient, will make a big difference.
Right. Just say increase your technique. I mean, then it should be obvious
Yeah,
why.
exactly.
Sometimes,
Yeah, they
honestly,
need to know.
my technique, I get so involved with the positioning and then I just rely on what the default technique is on the portable. And I'm like, oh no, I did it again.
Yeah, but like a tech that I was telling me like to treat like the patients kind of like a family member. Like you don't want to put like a cold board behind them. You want to put it under the sheets because she's like, feel it against you, like it's really cold when you put it behind them. Like it's better to put it behind the sheet so they don't feel it.
Right. I
Like
like to
she's like, she was like telling me, I don't want like I wouldn't want my dad to feel that.
I like to make a little joke. I'm like, I'm going to be super mean and take away your comfy pillow and replace it with this hard board. And they laugh, but it's like prepping them, for what they're going to feel.
Yeah. All right. So Kendra, do you want to share next?
Sure. So, I mean, it's been pretty routine at my site, like this week.
Mm.
And for some reason, there's just this one technologist who, I don't know, she treats me like I feel like she treats me like a 5-year-old, and she doesn't like communicate very well. So like all the other technologists let me get in there and try the positioning and the technique, and they don't just like they communicate, if I'm doing something wrong or if they think that I can do something better. So I was trying to comp on something yesterday. There were two things, and she just like comes in and just starts taking over. And I'm thinking in my head, lady, like, let me try this at least, right? And then there was another case where we were doing AP chest portable, which I have comped on, and I'm trying just kind of different techniques because I've heard from different technologists, like, you can actually bring it in just like straight away and not have to angle it so much, because sometimes if you angle it too much, then you get the shadow of the jaw in there in the head. So I think that's really ugly. And also someone told me when I tilted it too much, it almost looked lordotic, which not the good thing to do. So I had this all set up, ready to shoot, and she just like pushes right past me and adjusts the angle of the tube. And I was just like, my gosh, that's rude. But I just let it go because this is really the first time she's actually talked to me. Like I always like put it as like she just doesn't like me, but I think that she has put herself in a situation where she's not really sure of herself with taking the shots herself and just with the protocol at this site because she's relatively new. And then yesterday, the person who's usually in charge of the department had to go out for a dental exam. And so she was kind of left alone. And so then I kind of wrote it off. Well, maybe she's just stressed. And so she's in her head thinking and just wanted to go like how she normally does and didn't want any interference, different things coming her way that might vary how her workflow goes. So I'm trying best how to figure out how to like address this issue with her, other than saying, hey, I just want to let you know that I am comped on these things and it might take me a little longer, but I do need to get in there and figure it out for myself in order to learn. And I'd really appreciate it if you just let me flounder. And if the image comes out bad, then I'll have to retake it and put it on my retake log.
Yeah, usually like I have kind of a like tech that does something like that similar. So usually before going in for a comp, I'll just tell her like, hey, I'm gonna try for a comp, but if you see me like really struggling, you could come in and help me. So I give her like the option to come in and help me if like she sees that I'm like not gonna get it or like I'm doing something wrong, and then she'll come in and fix it. So I think it's kind of like worked out where sometimes she won't even jump in unless she sees me like actually being like, okay, she's not getting something.
Right. And it takes me like a little bit,
I
like,
don't know.
you kind of have to get in there and flounder a bit to figure it out. I just don't want, I'm like, don't, I know she has like a 4-year-old. I'm like, don't treat me like your 4-year-old lady. Like, and I'm trying to like be completely professional with her, but it's a little difficult.
Yeah, it's hard because when you want to comp, it's like you don't want them to interfere at all because then you won't get it. But it's like,
Right. Yeah.
but it's like, but that's what I've been doing. Like before the exam, I'll just explain to her like, oh, like if you see me really struggling, like you can come in and help me, and
Yeah.
then and then she'll be like, okay. So it's kind of like delayed it where like she'll like wait a little bit and be more patient. So I feel like it was like a little bit helpful in that sense.
Yeah. I kind of feel like the dudes, like they hang back and like know that you just got to sink or swim. And I kind of prefer that more than just like, it's almost like an over mothering kind of thing. I'm like, back off, lady.
There's a tech like that on my site. Like as soon you don't even have to like say anything or do something wrong, he'll still just jump in and start taking over your exam. So a lot of us tend to like distance ourselves from him because we learn from watching, but like we learn even more from actually doing, and like he's kind of taking that away from us. So we kind of just back off and like follow a different tech.
Agreed. Like I normally would have asked another tech to comp me on the exams, but she was the only one there. Yeah.
Yeah, I like your solution though. I mean, either talk to her about it, like let her know, hey, so I am trying to comp, I am a student, we're not busy right now, so I'm just gonna take my time and make sure I do this right. Or yeah, if you have the availability, I mean, right now you just said that she was the only tech there, but if you have the availability, go to another tech that you know that is a little more open.
Mm-hmm.
Yeah.
I've heard from the other technologists that you definitely learn from your mistakes. So it's
Definitely.
let me make the mistakes, it's
Yeah.
okay.
Yeah.
Yeah, thanks.
Does anybody have anything else to share? No? Okay. I think that's it. So thank you guys.
Right. Thanks, Crystal.